Our role at the Cancer Association is to create public awareness and encourage the public to be sun smart.
Saw the sticker on my car, was a bit shocked, went and got checked.
Got ourselves checked by a dermatologist. Everything's great, so we're glad we actually popped in.
I had a little spot that I was worried about, and they've referred me on.
Skin cancer is one of the most preventable cancers, and yet people often die from it. People shouldn't be dying from skin cancer.
Skin cancer is the most common cancer worldwide. Now, South Africa has the second highest incidence of skin cancer in the world after Australia. Approximately 20,000 South Africans are diagnosed annually with non-melanoma skin cancers, and 1,500 are diagnosed with melanoma. It is important to take note of the fact that everyone, regardless of racial or ethnic group, is at risk of getting skin cancer. The Cancer Association of South Africa runs a Sun Smart campaign from December to January to remind all South Africans to be sun smart throughout the year, and especially during summer. So today we discuss skin cancer. We're joined by a health specialist from the Cancer Association of South Africa and someone that is a survivor of skin cancer. You can tweet us at SABC Health Talk or simply just interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show coming to you just after a short break. I'm Dr. Sello Mutaung, and this is Health Talk.
Life can throw all sorts of surprises at you, often when you least expect it.
Sorry, Mom.
That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
The Kalahari Transportier Park is a large wildlife preserve and conservation area in southern Africa. Kalahari means place of thirst. The total area is 38,000 square kilometers. Approximately 3/4 of the park lie in Botswana and 1/4 in South Africa. South Africa embraced the concept of transportiers linking ecological reserves across national borders. On the 12th of May 2000, President Festus Mogae of Botswana and Thabo Mbeki of South Africa formally launched South Africa's first peace park. It has 200 species of birds, including vultures, mammalians such as black Kalahari lions, and large herds of herbivores, namely elands, springboks, blue wildebeest, and more.
For Sonia, working from sunset till sunrise with her high school students for the past 3 years has annually been the highlight of her year. Her life as a child and from then on has been inundated by cancer, losing her own mother to this disease and her own diagnosis and the subsequent supplement of her life insurance made her value and feel each breath each day.
I was driving to the school's offices in Houghton, and I got a call on my cell phone, and it was from the surgeon himself, not his nurse or anything. And he said, "Where are you now?" Very abrupt. "Can you please make a U-turn and come straight back to me, because we've got to decide on your treatment going forward." And I want to tell you, my heart nearly stopped, because I'd lost my mother to cancer. I'd lost my aunt to cancer. I'd lost a number of friends to cancer, not skin, not melanoma. But cancer was the big, scary word for me. Do you know what I mean? I really didn't want to have a diagnosis of that ever.
Cancer affects your emotional health, and having feelings of depression, anxiety, fear are a very common and abnormal response to this life-changing experience.
For me, it felt as if the world kind of... two things. I can remember standing at my post box with my heart beating, my heart literally beating in my chest, thinking, I'm going to die. Everybody knows a stage 4 cancer, you know, most of us know it's the writings on the wall. I had made up my mind I wouldn't have treatment and things like that. I had seen too much of how chemotherapy and radiation even does so much damage while it's trying to fix you, and I had made up my mind I don't think that I wanted any of that.
Common methods for treating cancer include chemotherapy, immunotherapy, surgery, and radiation.
A huge chunk was taken out of my back. Now, the lesion was near my spine, so there's not much flesh there. And so there was a huge hole with no, it had to granulate in from the outsides, and that was a very scary thing to see on one's body. It took weeks and months to come right. So the surgery helped, but they couldn't do anything else for me in terms of chemotherapy or any of that. Thank goodness we realized that the surgeon had taken out so much of the surrounding tissue that nothing had spread, nothing could get to my lymph nodes. And I'm really grateful, because here I sit today.
For her, it is time to make sure that we speak openly and factually about cancer and how to avoid it by making better lifestyle choices from a younger age.
I was teaching a young lady that was in my matric year at that time, and through her mother worked at the Cancer Association. And that's how I heard about Cancer Relay. And they came to explain how Relay works and what the philosophy is behind Cancer Relay. And it really, really sounded like a wonderful idea to me, particularly because it would expose so many young people, teenagers, the children I work with, and their families, and everybody else by association in a ripple effect, to getting to know the facts about the sun. See, we hear a lot about don't smoke, exercise, watch what you eat. We don't hear enough, in my opinion, it's getting better, about sun damage. We don't.
All right, so let's learn more about skin cancer from our guest. And it's a great pleasure to welcome no stranger to this show, Professor Michael Herbst, who's a health specialist from the Cancer Association of South Africa. Welcome to Health Talk, Prof.
Thank you for having me today.
All right. So perhaps let's start from the beginning. I mean, we're talking about skin cancer. Perhaps just to give our viewers some idea of what it is that we're talking about. I mean, the skin, perhaps. What is the function of the skin? Why do we need the skin?
Well, you know, the skin is definitely one of the most important organs of the body.
Right.
It covers the body. It isolates it from any negative influence from outside.
Right.
It allows us to cool the body through perspiration.
Yeah.
So it really has major functions. Mm-hmm. And if something goes wrong with the skin, like if you get severe burns of the skin, if you get 50-60% of burns, you're doomed to die.
Yeah.
Because the skin is so important.
And interestingly, I mean, it's the largest organ in the body, by the way.
Absolutely, because it covers such a large area of the body.
Right. So perhaps, for the sake of our viewers, just to simply understand that it's a complicated, I mean, it may look like it's you know, I mean, it's simple, it's just skin, but it's actually got several layers to it. It's got 3 layers. We have a deeper layer, we have called the dermis, and then of course we have the epidermis. Now we're going to be focusing our discussion around the epidermis, and we do know that there are several types of cells in the epidermis. Do you perhaps just want to take our viewers through those?
Yes, I think one of the most important of the different cells that are there is the one that we refer to as melanocytes.
Right.
They are very important in that they produce melanin.
Right.
And melanin is a substance that is produced in the presence, especially of sunlight.
Right.
And it aids and protects the skin against the UVA and UVB rays of the sun.
So this is the one that gives the skin our pigmentation.
Our skin tone, yes.
Correct.
So people who, like myself, will have much less melanin in my skin than somebody of a darker skin tone.
Right. So we have melanocytes. And then any other types of cells that we have in the epidermis?
Well, there are horny cells as well that really covers and protects. And then we've got the cells where cell division takes place to replace cells that are shed, because we continually shed cells from the skin.
Yeah.
And they divide and multiply under a very controlled manner.
Correct. Perhaps just to give context to this, we will name those cells. Right at the bottom of the outer layer of the skin called the epidermis, we have cells called basal cells, which are the ones that divide up, and as they divide, they get pushed to the outer layer of the skin, and they call the squamous cells because they are almost like, flattened out, as it were. So we have the squamous cells, we have the basal cells, and we've described the melanocytes. Okay. This, of course, leads us to what we're talking about today, different types of cancers.
As you said in the introduction, we divide them up into non-melanoma skin cancers and the melanoma skin cancer.
Okay. And the non-melanoma skin cancers are?
Will be squamous and basal cell.
Okay.
So squamous cell will be the most superficial ones.
Right.
And then the basal will be the lower layer below the squamous one.
Right. So before we start talking about how common this is, let's talk about the concept of cancer. How does cancer happen?
Well, there are three characteristics before we can call something cancer.
Right.
The one is that there must be abnormal and uncontrolled multiplication of cells.
Right.
But we know that even in a benign or a non-cancerous tumor, there's also multiplication of cells. So that shares that same characteristic.
Right.
But in cancer, apart from abnormal and uncontrolled multiplication of cells, we also have the fact that it can invade nearby tissue.
Right.
So it can, apart if it's in the skin, it can move into the skin into deeper layers.
Okay, and that's when we call it malignant.
Malignant. And then there's the third characteristic that finalizes the definition for cancer, and that is cancer cells have the ability to move from one part of the body to another. And we talk about metastases or spread of cancer through the body.
Right. Okay, let's then talk about these three different types of skin cancers. I mean, we said in general, skin cancer is quite common.
It is very common.
Right.
Unfortunately, the latest statistics that we have are those for 2014. And we must remember that the National Cancer Registry is only a pathology-based registry, which means that only cases that have been diagnosed in a laboratory following the taking of a biopsy are included. So we know that the 25,000 cases that have been reported in 2014 is underreporting, because many cases are diagnosed in many other different ways.
Or some of them not even diagnosed at all. Right.
And what is important, I think, for our viewers is we very often think that skin cancer is a white disease of people with pale skins.
Right.
But of the 25,000, 4,000 people were diagnosed in 2014 with darker skin tones. And that is quite a figure. That means that there were 11 people with darker skin tones diagnosed every day of the year 2014.
That's quite startling.
And that is shocking.
So of the different types now, do we know, I mean, we generally know that the non-melanoma skin cancers are more common than the melanomas.
Absolutely.
Yep. And do we have exact proportions that we can talk about?
I think we can say that about 60% will be the squamous cells, and then another 20 to 30% will be the basal cells, and then eventually the melanoma. I think that's a rough, maybe the figures that I've given doesn't even add up to a full 100, but more or less.
Okay, so let's talk about the clinical factors then. So how will someone know that I possibly have skin cancer, or how is it diagnosed?
This is where my favorite topic comes from. When I talk to people about cancer, I say to them, look, it is absolutely important that you know your body. You've got to know your body from the top of your head to the soles of your feet. And how will you know it? When we talk about the skin, is to take the opportunity, especially when you have had a shower or a bath, when you're drying, try and stand in front of a full-length mirror and look at your body. Look at your body from the top of your head to really, and look under your feet even. Because we know that that is where melanoma especially can show its face. Then...
And we're going to repeat this when we talk prevention, because I think this is very important.
Absolutely. You've got to turn your back to the mirror and then use a hand mirror and look at your back and see your body on the back as well, and watch the skin from the top to the bottom. Even go to the extent, every now and then, to ask somebody to look at your scalp. Because many people neglect the scalp.
So where do we see these cancers, for instance? And when we hear that the non-melanoma skin cancers are in the sun-exposed...
Mostly in the sun-exposed areas. So where will that be? It will be the things that aren't covered by my clothing normally. But it will be the legs and the arms, the ears, behind the neck and the face. And then if you don't wear a hat, yes, sometimes very often on the scalp itself.
And what does it typically look like? You know, or do we know? Because people have all sorts of spots on their skin.
Absolutely.
They should be able to say, no, I've had this spot, I know this spot, or this one looks a little funny.
And especially when we get older, we got what we refer to as the age spots. But they normally form a little crust. And that will be now the squamous cell carcinoma. It'll form a crust, and it doesn't go away. Even if you scratch it, you may remove the superficial layer, but within a day or two, it will be back again. And if neglected, then we can start expecting problems, and it may move deeper into the skin itself. The basal cell comes from the deeper layer of the skin, and that very often gives a more reddish and pinkish color as it appears on the skin.
And it appears as a bump.
As a cluster that is appearing there. And is much more prominent and very often much more noticeable than the squamous cell carcinoma.
And of course you mentioned the melanoma, because we shouldn't confuse that to normal skin moles, as it were.
No. That is why we will educate people and say, if you do have a mole, yes, watch it. But don't think that because you've got a mole, you're going to get melanoma. You've got to watch that mole and watch it carefully. If the two sides... If you sort of cut it in half and the two sides are nice and smooth and more or less the same size and the same shape, you're okay. But when it starts making an irregular pattern, when it changes color, when it evolves, and that's where we talk about the ABCDE.
I think that's a good point to stop here, because
that is so important.
We're going to have to come back to that. Okay, time for a quick break. When we come back, we continue our discussion on skin cancer. Please stay with us.
On Media Monitor, we leave no stones unturned.
We don't have shared principles when it comes to media freedom.
From the integrity of journalists to accusations of fake news.
If anybody comes with an alternative view, he starts referring to it as fake news.
We also look at the safety of our journalists while covering stories on the field.
This is something that we're faced with daily, from journalists who say they've been physically or verbally attacked by community members.
Watch Media Monitor Sundays at 9 a.m.
A meteorite hit the Earth 2 million years ago, creating an enormous impact of crater, about 10 kilometers in diameter, near Vredefort in the Free State. 100 kilometers southwest of Johannesburg, now known as the Vredefort Dome, a South African World Heritage Site. The meteorite is said to have been larger than Table Mountain and caused a 1,000 megaton blast of energy. The impact would have heated about 70 cubic kilometers of rock and have increased the Earth's oxygen levels to a degree that made the development of multicellular life possible. The world has about 130 crater structures of possible impact origin. The Vredefort Dome is the largest in the world, followed by Sudbury Crater in Canada and the Chicxulub Crater in Mexico.
Congenital disorders or birth defects are defined as abnormalities of body structure or function that are present at birth.
Some of those defects, they can come as an isolated or they can be in combination with a syndrome.
According to the World Health Organization, 300 million people are affected by depression globally.
One can be depressed as a child, and then later it manifests in early adulthood.
Join us on Health Talk, Saturdays at 9 a.m.
Okay, welcome back. We're talking skin cancer with our guest, Professor Michael Herbst from the Cancer Association of South Africa. Now we're joined by another special guest, Nicole Kepper. Now, Nicole, just apart from her being Mrs. South Africa 2018, she's a skin cancer survivor, and that's primarily why she's here. Welcome to Health Talk, Nicole.
Thank you for having me, Dr. Sello.
All right, we're going to come back to you. Before we start our discussion and hear more about, Nicole's story, we have a few tweets that we just want to go over quickly, and as soon as they get up on the screen, we will just go over them. And before starting our discussion on, the impact, causes and risk factors for skin cancer. The first one says, in many of our countries in Africa, skin cancer kills our sisters and brothers with albinism. Some governments have not as yet provided for this. And I know we have a long way to go as South Africa, but I'm grateful that a sunscreen can be obtained. John Peters says, awful. Young black people in South Africa risking skin cancer by using skin bleaching. Children of Fire says, skin cancer ruins lives. The sun in South Africa is harsh. Protect your skin with high protection factor sunscreen, whatever your skin color. And Ed says, there's too much hatred of one's ethnicity going on here and in South Africa with their skin bleaching trend. Causes skin cancer and unrepairable, painful skin conditions. Very true. All right, so let's talk about, Prof, I want us to just visit this concept of, obviously, there are people that are at risk of developing skin cancer and of course, some of the causes. All right, we're going to come back to that. But I'm very much interested in talking to Nicole. And Nicole, you were diagnosed with skin cancer at some point in your life. Please share your story with us.
Thank you. It was one of the biggest shocks of my life. You never expect a day like that, and least of all when you're 25.
Right.
So I was 25, and I've always had lots of moles and freckles all over my body.
Right.
And I did have a history in my family which I knew about. So I've always been very conscious about the sun.
Right.
Very good with sun protection, and always checking my moles, and regularly visiting a dermatologist from when I was young.
Really?
But
why were you choosing to visit your dermatologist? Was it because of this history in your family?
Yes, because of the family history.
Right.
I was merely being cautious. I still never anticipated. You think maybe one day when I'm 50 or 60, maybe then it would get real. And until then, I'm just being, I'm a pharmacist by background, so I knew about protecting myself, being very health conscious, and being safe. So I was over safe, and I'm glad I was.
So what then happened? What symptoms did you realize?
Well, actually, at the time, I purely went for aesthetic reasons because I have a lot of moles. I have had many off during my life because they tend to rub on my clothing and get in the way. So I went and had a few off. And at the same time, a friend had said to me a few weeks prior, we were actually on a holiday on the beach, and my friend noticed a very small black spot on the back of my leg and said, I've never seen that before. And it's very dark, but it was tiny. It was literally the size of a pinhead. And I didn't even think twice about it. I just added it to the list of moles to be removed. But when I went to have my stitches removed, the doctor sat me down and said, you have malignant melanoma.
Really?
And that was one of the biggest shocks of my life.
So you obviously knew what malignant melanoma was at the
Yes,
time.
I burst out crying. I mean, I knew. My gran had actually had the same thing in her 60s. So
Tell us about your gran. We'll come back to what actually happened to you, but let's talk about your gran. She had the same condition?
yes, so my gran spent a lot of time outdoors in the sun. She was a hockey player when she was younger, and she had noticed a lesion on her nose, and she left it for a very long time. And she refused to get advice or see a doctor or a dermatologist. And when she eventually did, it was malignant melanoma, and it had spread quite extensively through her nasal tissues. So she ended up having a lot of surgery and a lot of nose tissue removed, and had to have multiple skin grafts on her face. And it was incredibly traumatic and invasive for her to go through that.
Prof, there's a lot that we can take from her. Firstly, about the family history, you know?
Absolutely, one of the very important things to remember.
Right.
If you have a family history, like Nicole told us, this made her conscious of really taking care and having her skin attended to.
Are there other genetic factors, perhaps, that we know? Well, I mean, obviously, we're saying the family history. That's the genetic side. Are there other risk factors out there?
Well, you know, we had this wonderful tweet that appeared on the screen. People with an absence of melanocytes in their skin. People who have the disability of being born with albinism. They have no protection against the sun whatsoever. But we can really add and say that fortunately in South Africa, they do get their supplies of sunscreens through the National Department of Health and the provincial departments of health.
Which is
We'd like to see that the quantity is increased, because the volume of sunscreens they get is really not enough.
So we'll get back to that. So albinism or some malformation of your melanocytes and your inability to produce enough.
To produce melanin.
Okay. You mentioned the sun. I mean, when you come to the environment now, is that the biggest cause of skin cancer?
Definitely, you know, and how big a cause the ultraviolet rays of the sun is. Research has shown that one blistering sunburn before age 18 is a sure ticket to have skin cancer later on in life. Just one blistering sunburn. So people should really be very, very careful in the sun. And what people very often forget is that when it's cloudy, the ultraviolet rays are still there. And you don't only get directly from the sun. If you sit next to a swimming pool or on the beach, you get it directly from the sun, and you also reflect it off the water and off the sand from the beach and also from the paving alongside the pool. So you get it from various angles.
All right. We're going to spend quite a bit of time talking about the sun, I mean, hence your Sun Smart campaign. But let's move over to other issues, other environmental issues. There are people who work in environments where they are either exposed to stuff that will damage their skin and put them at risk of developing
cancer. And they are expected to work in the sun. We think of people who are on the road construction. We think of people on the farms. Horticulturalists. We think of people who protect our game in the game reserves. You know, there are many people who are directly exposed. And interesting, just I can say to you, I requested a law firm not very long ago to hear, has an employer got a responsibility to protect his or her workers against specifically the ultraviolet rays of the sun? And they looked at the Occupational and Health Safety Act and really came up and said, yes, they must provide them with protective clothing, with sunscreens, etc. And I think this is something no employer, according to my knowledge, has been challenged. But the day it comes, it can be a big story.
We're talking about a group of employees exposed to the sun, as their job entails. What about chemicals? Some people that work indoors and are exposed to certain chemicals?
Yes, we know that there are chemicals that aren't very good to the skin, that can affect the skin and affect the ability of the skin when it is exposed to sun to produce melanin. And that is very important for us to remember.
And of course we can spend the whole hour talking about the ill effects of bleaching, skin bleaching, which obviously puts, people at risk of developing cancer.
And this is the weird thing, people that have got pale skins like myself, we want to become darker in our skin tone. And people who have got a darker skin tone want to have their skins to be lighter. And there is no such thing. But I want to say to people with pale skins, a pale skin doesn't show that you are not healthy. And my concern is really this time of the year when the matriculants have their proms and whatever, that a lot, especially of the girls, will go and expose themselves to sunbeds.
The sunbeds, yes. Let's talk about that.
Because that is a major cause of especially melanoma. And
because they market it as safe and you are in an enclosed environment, you're not exposed to the sun.
And we'd really like to see the Department of Health come out with regulations to regulate the sunbed industry, to prevent people from under the age of 18 exposing their bodies to the sunbeds. Brazil has totally banned sunbeds. There isn't a single sunbed, they tell me, in Brazil. And in South Africa, it's totally uncontrolled still.
Well, I think it's a good time to quickly have a break. When we come back, we'll continue our discussion on skin cancer and talk this time about prevention. Please stay with us.
Fashion, travel, music, food, and food. Did I mention food?
We at Trends Travel love bringing you cuisines from around the world.
Forbes US have declared Gabon the coolest city destination to visit in the world for 2018-2019.
You know, as designers, we're always setting trends and also doing like high fashion. So it was quite nice to come and see the ready-to-wears every day.
We at Network explore all things technological.
The modern battlefield is the battlefield of the mind, and the tools for affecting the mind are social media.
We look at how technology advances medicine and education.
Children can learn up to 60% more information in a shorter condensed amount of time using virtual reality as a medium for instruction.
From music, gaming, even computer-generated supermodels. Be a part of our network Saturdays at 8:30 p.m. and Sundays at 5:30 p.m. On Media Monitor, we leave no stones unturned.
We don't have shared principles when it comes to media freedom.
From the integrity of journalists to accusations of fake news.
If anybody comes with an alternative view, he starts referring to it as fake news.
We also look at the safety of our journalists while covering stories on the field.
This is something that we're faced with daily. From journalists who say they've been physically or verbally attacked by community members.
Watch Media Monitor Sundays at 9 a.m.
Okay, welcome back. We are with our special guests, Professor Michael Herbst from the Cancer Association of South Africa and Nicole Kepper, a skin cancer survivor and the 2018 Miss South Africa. Maybe let's stay with you, Nicole. We're talking the most important aspect of our topic today, prevention.
Yes.
Right? Now, as Miss South Africa, we were talking earlier and you were saying that, part of the advocacy work that you do is around skin cancer. Just take us through what that entails.
I was very fortunate during the process of Mrs. South Africa to raise money and funds for an organisation where we were affiliated with the Cancer Association of South Africa.
Right.
And that was a great privilege to see what work they do. And I raised almost 100,000 Rand for them and for the sourcing of photo finder machines. So they play a large role in South Africa in terms of diagnosis. But for me, I've become really passionate about prevention and not from the perspective of fear.
Right.
I think when we hear the word cancer, we immediately panic and sometimes we even stick our heads in the sand. We'd rather not know or get checked out. And For me, I embrace a healthy, active lifestyle, which actually means spending a lot of time in the sun. And I'm not afraid of the sun. I just wear sunscreen and I get regular dermatologist checkups, which for me is every 6 months to a year. And that is actually what it should be for the healthy individual. Like you go and have your teeth checked at a dentist, you should go and have your skin checked at a dermatologist. Don't be afraid of the sun, don't hide indoors. Embrace this beautiful country and your body and be active, but just live preventatively.
Right. Very, very profound. Prof, even before we talk about, prevention, just managing skin cancer is huge, financially. Just take us through that.
Well, I'll tell you, the management of the whole process is to really know how it develops in the body.
Yeah.
And we spoke earlier, just before we had the break, and we just quickly mentioned the ABCDE.
Yes.
And I think that's important that we tell people about
so this
the
is
ABCDE.
about, examining yourself.
Examining yourself, because that is part of prevention, is to regularly examine the skin and back and front, and then especially if there are lesions that don't heal within a period of 7 to 10 days.
So how often should people then examine themselves? Daily, monthly, weekly?
Not less than every 6 months.
Right.
They should really and have a thorough examination of the skin front and back.
Let's go through that ABCDE and, basically explain how they must do it. You said from head to toe, yeah?
Great. So the A will stand for asymmetry.
Right.
And here we will take the lesion or a mole on the skin and we will see that the sides and all around it, there's symmetry in it. There's no ragged edges or this side has got a bulge and this side is all clogged in.
Yeah. Or
So
if
there
you've had
must
a
be
mole
symmetry.
that had been previously symmetrical and
changed its
suddenly
shape.
changes on the edges, yeah?
Yes.
Okay.
So a border fits in very well, again, with the asymmetry, where we now specifically look at the border, and can you trace a smooth border?
Yeah.
Or does the border sometimes just make it looks like little flames, and it infiltrates into a surrounding part?
Right.
C stands for color.
Right.
Any mole or skin lesion that changes color, and that appears on the skin that is different to the other moles. We heard Nicole talking about there was one little skin lesion on her leg that was black, and it was different to the other moles that she knew she had on her body and those that she'd already had removed. So color is important. If it changes color or if it's of a different color to the moles that you have, then it's important. D will stand for diameter.
Right.
And here we normally say that a mole or any other skin lesion bigger than 6 millimeters needs urgent attention. What is 6 millimeters? It's about the width of the eraser on the back of a pencil.
Right.
That's about 6 million. And then E will stand for evolve.
Yeah.
And evolve meaning it is continually changing.
Yeah.
It's changing in color, changing in shape, changing in its whole form of, but it looks different now than it did a few weeks ago.
Yeah. Very, 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 very useful to use that ABCDE.
Absolutely.
But other practical guidelines would be like to say, people should use the full mirror and a handheld mirror to basically look at their entire body to make sure that they know exactly what they have. If they notice something that is there that wasn't there before, obviously, to then go to their doctor.
There's, of course, always beautiful equipment, and I'm sure Nicole can tell us more about it because she's walked the walk. And we refer to a photo finder, where the dermatologist will, of any lesion that may be suspicious, will take a photograph and it's stored in the memory of the computer. When you go back, that same lesion on the skin is photographed again under the same lighting conditions, at the same distance, and it is compared today's picture to the picture of 6 months or a year ago. And you can see the E especially on there, the evolve, well, even the change of color, the diameter, everything of the ABCDE can be spotted on there.
And we heard recently, I think about a year ago, of even an app that has been developed on mobile phones where you can use to track, the size of the moles that you have.
I think provided that the app makes provision that we photograph always from the same distance. That's important, because if you photograph from 30 centimeters last year, and you now photograph from 15, you're going to get a change in size. So keep the distance and the same type of lighting so that the color changes won't be influenced by environmental factors.
Okay. Nicole, I mean, he mentions environmental factors, and the biggest one, obviously, is exposure to the sun.
Yes.
Yes, I heard that you're saying, in terms of fear, people shouldn't fear the sun, but obviously they need to be smart about how they expose themselves to the sun.
Correct.
Now, there's issues of skin protection and sunscreens and so on. Some of them can be quite costly.
Yes. There is a reason why some of them are more expensive, and it is a bit of a risk-benefit ratio.
Right.
You have to look at a product. I know there's been a lot of research about different chemicals in sunscreens and whether they are harmful to your body or not. And although as a pharmacist I do tend to agree with some of those separately, at the end of the day the risk outweighs the benefit. And I think the risk here is skin cancer. So sunscreen, even if you have access to very cheap sunscreen, perhaps it's better, and you can give me your opinion, perhaps it's better to use sunscreen, anything rather than nothing. There are some very advanced sunscreens on the market, and I know there's a new scale that has also been developed. You have your A++, and even some sunscreens that help repair your DNA at the same time as protecting you from the sun.
Well, I mean, it's good that you mentioned that, because people walk into a pharmacy and they say, I need sunscreen. Perhaps there might not be somebody that, there to assist the person to say, and then they see all of the skin protection factors. What should people be looking for? How should they be, taking themselves through these aisles and pick the right ones?
I think we live in the information age where people have access to information, so it's not really an excuse anymore.
Right.
It's about, do you take your sun protection seriously?
Right.
Then go and do a little bit of your own research and find out exactly what you are looking for in a sunscreen. When you walk into a pharmacy or a grocery store, going buying your sunscreen, you know what you're looking for on the ingredients in the bottle. But definitely never an SPF less than 30. If you can put on an SPF of 50, it's way more beneficial.
So the more the SPF, the more the protection?
Yes, but we must remember that the difference between 30 SPF and 50 SPF is not double, because between 30 and 50 is about double. It's a number that is worked out according to a formula. And a SPF 50 sunscreen will provide about 2 or 3% more protection than a SPF 30. But SPF 30 is the standard. That is really very good. And I think what is important, we must say, that people must be very careful with toddlers, children under the age, babies under the age of 6 months. Please never apply. They've got to be kept out of the sun. And never apply any sunscreen to their skins, because their skins are far too sensitive for it. The other important thing is that with most skin sunscreens, you have to apply it at least 20 to 30 minutes before going into the sun, so that it is activated on the skin, and then it provides the protection. And then what does the SPF mean?
The reapplication of sunscreen.
We're getting to that as well. It's so important. Thanks, Nicole. Is what does SPF mean? If you know that your skin burns red in 10 minutes and you apply an sunscreen SPF 30, it means that the sunscreen will protect your skin 30 times longer than the 10 minutes. But it needs to be reapplied at least every 2 hours. If you swim, even every time you get out of the water and you dry yourself, you've got to reapply the
What
sunscreen.
about the time that, is there such thing as, between this hour and that hour, if you can, just don't expose yourself to the sun?
10 o'clock in the morning and 3 o'clock in the afternoon. And that is the time that most people are very active. And this concerns me, because this is the time that school children have all their sport activities. And they are so exposed to the sun.
Well,
then.
it's holiday time. People go to the beach and they lie, along the beaches. And you basically are saying between 10 o'clock and 3 o'clock.
Be very careful and protect yourself.
Right.
And as I say, you can get the radiation coming from above and reflected as well.
Yeah, I think this is so important. We need to re-emphasize on this. But before that, we're going to go through just a few more tweets that have just come in. And, we'll take that just before we go for a break. Michael Moll says, great beach weather. Just don't forget your SPF 30 plus or more. Skin cancer is the most common cancer in South Africa. Mpo says our government must be thanked for making sunscreens available in hospitals and clinics for us with albinism. We have challenges, but those shouldn't make us unable to complement where progress is there. I thank the Department of Health for this. Self-Care says use SPF daily, especially in a hot country. For starters, it prevents you from the scorching sun, and it's also decreased the risk of skin cancer. The sun rays also dry out your skin, so it's crucial. And Joe says, my grandma has been fighting skin cancer for 7 years, and I'm so happy and proud to say my 91-year-old grandma kicked cancer's ass today. It's a good one to go on a break after. All right, time for another quick break. When we come back, we talk treatment. Please stay with us.
We're essentially talking about a condition where your body has a difficulty utilizing glucose effectively, so it starts building up in the bloodstream.
It's important to understand that one cannot cure diabetes, but you can manage it.
The best advice I can give is understand and know your diabetes.
About 70 to 80% of women will suffer uterine fibroids by the time they reach the age of 50.
There are a lot of women walking around who don't even know that they've got fibroids.
Join us on Health Talk, Saturdays at 9 a.m.
We pride ourselves on being impartial as well as independent. On the agenda, we basically break down the stories of the day.
Give the viewer the assurance that we will cover every side of the story.
Tear gas has now been also thrown at the protesters.
We are peacefully marching and the police is stopping the people, they're hitting the people, we are spraying the people with pepper spray. These people are supposed to protect us, but they are against us.
We are pushing them back by using the rubber bullets because we cannot allow them to block the roads and damage other people's property.
Quite important to bring on board all sides and hear what everybody has to say about the story, especially being the public broadcaster.
All in all, we basically take the news agenda of the day forward.
Welcome back, and thank you so much for staying with us. If you've just joined us, we're talking skin cancer with our two guests, Professor Michael Herbst, the health specialist from the Cancer Association of South Africa, and Nicole Kepper, the skin cancer survivor, and of course, Miss South Africa 2018. We'll have to wrap this in, Nicole. All right. I mean, we spend quite a bit of time talking about prevention, and the most important aspects, really, of prevention, to say it is important that instead of thinking about whether or not there's treatment, you prevent. The old adage, prevention is better than cure.
Absolutely.
Let's just wrap up our discussion on prevention. Nicole, let's start with
I know that there's such an importance about staying out of the sun, wearing your sunscreen.
Right.
But for me, I was that person. I never lay in the sun. I wore sunscreen every time I went out, and I still got malignant melanoma at 25 years of age.
Right.
And for me, that creates a real focus on body awareness.
Yeah.
And visiting a doctor regularly for checkups.
Yeah.
So, like you said, just look at yourself in the mirror. Don't be afraid to examine your body. And that's for all cancers. That's for breast cancer. Obviously, skin cancer, to just know, even your back, all of the strange areas. I've had moles removed from my scalp.
Right.
And I think that it's really important to be aware and then have an expert professional check you out regularly. A doctor that knows you well, that can track the progress of your moles and your freckles.
You know what Nicole mentioned now is so absolutely important, especially when it gets to melanoma, because we know that the melanoma may develop in the skin of my hand, but melanoma cancer cells has the ability to land in the bloodstream or the lymphatic system and go to other areas of the body. And you may all of a sudden have it appearing in the liver, in the lungs, in the abdomen, in the eye, in the brain. And so we've got to be very careful. I think the best example that people will know is Bob Marley.
Right.
He thought that he injured his toe by kicking a ball playing football with his friends. And he actually had melanoma under his toenail, and this killed him. And what a loss to the music world of a man at his age. And we've got to be aware, and especially, you know, people with darker skin tone tend to develop melanoma on the palms of the hand and the soles of their feet, parts of the body that isn't exposed to the sun.
Correct. Yes. Very, very, very important that they actually have a look at that. I mean, it's difficult to look at, you know, under your foot, but the mirror, as I said before, I mean,
make the mirror your friend.
Yeah. So coming back to treatment now, I mean, we basically are saying prevention, right?
Yes.
But of course, that's not foolproof. All of these things that we mentioned is not foolproof. Like, clear example in your case, that even if, you know, you are aware of these things, being aware of your body is more important, and that it helps you to pick it up early, because the message is the earlier it's picked up, the better the chances of survival. In fact, it's treatable. Let's come back to your case now. How were you treated?
I was very fortunate that mine was a Clark's level 2 melanoma.
Right, which
so
means?
It wasn't deep enough to have reached the deeper layers of the skin where it can spread to the surrounding tissues and surrounding lymph nodes, and then obviously to the rest of the body. So they excised a larger portion of tissue, and I still have quite a large scar from where they took that out. But aside from that, the lymph nodes around that were clear, and I didn't have to go for chemotherapy or radiation. I have walked that path this year with my mother. She had a different form of cancer this year, and she went through the entire chemotherapy 6-month process. And although it was difficult, what I can say is medical treatment saves lives. And instead of hiding and being afraid, to just embrace the process, trust your doctors, and go and walk a path alongside them, you can overcome these things. It's about early detection and then going through the treatment process, as hard as it may be.
Right. This is very true. Hey? And by the way, in the case of your grandmother, just to remind us again, she obviously presented a bit late, yeah?
And then she had a lot of surgeries to excise the tissue as well. She also had to go through chemotherapy, yes.
Chemotherapy as well, all right. So essentially what we're saying is the earlier it's detected, there's a 95%
earlier
even
treatment can be started, and the earlier cure can be, people can go into remission. And it can be very expensive if we neglect. I can tell you that I had access to a case not very long ago who had squamous cell carcinoma on his forehead, and he neglected this. And we were called in to come and see, because there were 2 children involved in his family, and this man was living with the children on his own. When we got there, he had a dressing on his forehead, and I asked him whether I could look at it, and he was a bit dazed, and he said yes. And I opened it up, and the squamous cell carcinoma had eaten through the skin, eaten through the skull bone, and his brain was exposed. He died 3 days later. Treatment then won't work. The same thing with melanoma. If melanoma advances, at the moment the cost in South Africa is 1.4 million rand per patient on average to treat a patient that has advanced melanoma. So it's not cheap. If you haven't got a good medical insurance, your chances of getting adequate treatment isn't very, very good.
And just on that, I mean, if it's advanced, you know, even the survival rate, you know, is a bit low.
It drops. It drops very quickly. They say that the 5-year survival rate of advanced melanoma is about 15%. That only about 15% of people will still be alive after 5 years.
That's why we talk about prevention.
Absolutely.
And by the way, the one sector of the population that we forgot is people who've had skin cancer before. That it's important that they continue.
Any type of cancer even. Because it shows that the cells in the body have the ability to have its DNA changed and to just have that trigger to start multiplying abnormally and uncontrolled and penetrating into adjacent tissue and then eventually metastasizing through the rest of the body.
Okay. So, Nicole, we're not saying you're going to get the cancer again, but you are still obviously continuing to check yourself on a regular basis.
Yes. Like I said before, it's important, especially for me,
Right.
to go and see a dermatologist and have my moles checked regularly, at least every year, hopefully every 6 months.
Right.
But it's not just for someone who's already had cancer.
Yeah,
That is
for
something that everybody should do.
Right. Okay, so treatment, I mean, obviously we spoke a lot about surgical treatment, and which involves having to cut the entire tumor or cancer out with a little bit of the surrounding.
That's
normal,
right.
Right. And of course, you'd rather live with a scar than,
Absolutely,
your
and live
family's-
with a scar than die with a whole body.
Right,
Yes.
right. So, other forms of treatment other than surgical?
The basal cell and squamous skin cancers can be treated if they're diagnosed early, just with what we refer to it as cryotherapy. It is where they are frozen. And it leaves you look a little bit funny for 2, 3, 5 days after treatment. But as soon as the little scabs have fallen off, the skin returns to normal and you don't see it again. But anybody who has had basal or squamous cell carcinoma, they've got to be very, very careful. And interestingly enough, we see that they will have most problems on their right arm and right hand and the right side of their face, because that's the side that they sit in the car most of the time. And with women who don't drive the car, we see them that they have it on the left-hand side of their body. So it shows that the sun plays a very major role in just triggering the cells in the body and altering the DNA, and so that abnormal cell development and multiplication can take place.
Okay. And of course, there's minor side effects. We mentioned earlier the issue of the scar. There could be some sort of disfigurement after, especially if, let's say, the cancer is on an earlobe or on the nostril and so on. Just take us through that.
Well, we have such beautiful cosmetic surgeons nowadays.
Yeah.
And apart from them, we've got people that are very well advanced in developing a beautiful artificial nose that you will meet somebody and not know that they've got a nose prosthesis, or even a whole ear or a portion of the ear. That can all be done nowadays. But of course, it will cost money. And again, you will need insurance to have that. So again, we're getting back to prevention.
Yes.
Correct.
Don't wait until you've got a half a ear falling off because of a basal or a squamous cell carcinoma.
There is hope. It doesn't matter where that small cancer is. What about support for people that have been diagnosed with cancer? Obviously?
Absolutely, because many people still, they only hear the word cancer. And they close off and they don't hear anything else. And we've got to provide them with that support and say to them, look, yes, it is cancer, and having had skin cancer, you may also develop another type of cancer later in your life. So let's take care of this now, and let's go through the whole process of what can I do to reduce my risk of getting skin cancer again, or of developing another type of cancer later in my life. Being active, eating the right foods, stay away from alcohol, smoking, don't overexpose your body to the sun. I mean, there are the basic rules, and this does not only apply to cancer. It applies to general health of the body.
I mean, people that partake in sport. You wanted to say something?
I think that's exactly where I wanted to go with that prevention. We all have genes in our body, whether it's skin cancer or any other disease, that can be triggered. And this is a new science of nutrigenomics, which is fascinating. We have the potential for disease, but all of that is unlocked by bad nutrition, consuming carcinogens, alcohol, smoking, inactivity, lack of exercise. So by promoting obesity, high levels of sugar, and by promoting healthy lifestyles, we can actually keep those bad genes locked and closed.
Right. Such a fascinating way to end this discussion. And Nicole Kepper and Prof. Michael Herbst, thank you so much for your contribution.
It was lovely
being here. All the best going forward. And let me take this opportunity to wish you and your families happy holidays. And to our viewers at home, thank you so much for staying with us. It's been such a pleasure to know that we are with you. And of course, we're back on your screens again next week, same time. And until then, happy holidays, and please do take care.